So, good afternoon. My name is Cassie Trewick. I'm one of the admission counselors here at Tulane University School of Public Health and Tropical Medicine. And I have the honor to introduce Dr. Shalean Collins, who will be presenting her Public Health Discovery Seminar Series on navigating vulnerability, building resilience, food and water insecurity, challenges, and solutions. And so, while she's presenting her seminar series, if you have any questions, feel free to drop it in the Q&A chat. And at the end, we will answer your questions. So Dr. Collins, take it away.
Great. Thanks, Cassie. Hello, everyone. Thank you for joining today. So like Cassie said, I'm going to be discussing my research and also my path to public health, just to kind of give you a little bit of flavor where I'm coming from and my background. I am a research assistant professor in the Department of International Health and Sustainable Development, and I did both my H and PhD degrees at Tulane. And I've worked either on the ground or remotely in over 30 countries, including most recently in Jordan, Syria, and Haiti. And as an undergraduate, I studied, so I'm a registered dietitian, and I had a really specific focus on maternal and child health. And during this time, I was able to go to Ghana, which I'll talk a little bit more about later in the presentation, but it really solidified my interest in pursuing a master's in public health. I then research associate at Cornell and Northwestern universities after my MPH, and I'll talk a little bit more about my MPH journey as well. And in my role at Cornell and Northwestern, I supported research projects in over 28 countries. I also served as peacekeeper in Morocco, where I was the president of the Gender and Development Committee, and created the first monitoring and evaluation strategy to evaluate if volunteers were appropriately adding gender sensitivity into their projects. And so I also taught health education classes and co-led girls empowerment classes through the U.S. Middle East Partnership Initiative, also known as MEPI, and the project is called Project SOAR. And so recognizing how much I learned about public health in New Orleans, I decided to return in 2019, where I worked as a high-risk dietitian for the City of New Orleans Women, Infants, and Children WIC department. Also during that time, the time when I was at WIC, COVID became increasingly more of a concern in New Orleans. And so I was also among the first team deployed from the New Orleans Health Department to do early COVID testing and screening in the pop-up outdoor clinics, where we were screening health workers and then later community members. And then sort of in the latter part of 2020, I decided to return to Tulane for my PhD, during which I interned with USAID to better understand how to improve food security through nutrition sensitive agricultural activities. And I completed my dissertation research on water insecurity. And so now I am a research assistant professor in IHSD, and my research primarily focuses on food and water insecurity, and especially in areas with additional vulnerabilities like conflict, HIV, disasters, that sort of thing. And so let's kind of back up a little bit. So we really should probably first define what food and water insecurity are and why they're important. And some of you on the call may already be well versed in this, others may not. And this might be your first exposure to it. So we're kind of going to start at base zero, but you can kind of heuristically conceptualize both food and water insecurity as these two images. So essentially, when you don't have enough food or water to meet your needs, and we typically measure these over a period of time to understand how water insecure or food insecure people are. So here, the time scale pictured is a week. And what we would do to understand if people are food and water insecure is measure how frequently people experience food and water insecurity to understand how severe their situation is and how best to design intervention. So if you picture it like the papaya on the left, maybe on Monday, there's a lot of food. Tuesday, there's sort of enough food, and then as you progress throughout the week you have less food available for your household, and we kind of think about food insecurity in that way. The actual definitions, like the textbook definitions of food insecurity, are a person is food insecure when they lack regular access to enough safe and nutritious food for normal growth and development and an active and healthy life, and this may be due to unavailability of food and or lack of resources to obtain food. And so looking not just at the availability of food, but maybe not being able to purchase that food because you don't have resources to do so. Similarly, the definition of water insecurity is the inability to access and benefit from affordable, adequate, reliable, and safe water. And safety here encompasses both the safety of the water for drinking, whether or not it will make you sick, but also the safety of collecting water. Are you able to collect water in ways that don't expose you to like violence or injury, for example? We also know that food and water are human rights, and they're also part of the Sustainable Development Goals. And so, the Sustainable Development Goals are, and this is this is pulled directly from the UN, but essentially they aim to transform our world. They're a call to action to end poverty and inequality, protect the planet, and ensure that all people enjoy health, justice, and prosperity, and that no one is left behind. And so, Sustainable Goal 2 is zero hunger. So, ending hunger and achieving food security and improved nutrition and promoting sustainable agriculture. Although we know we have a long way to go for both food and water insecurity. And then goal 6 is to ensure available and sustainable management of water and sanitation for all. And development goal 6 goes beyond drinking water, sanitation, and hygiene to also address the quality and sustainability of water resources, which are critical to the survival of people on the planet. The 2030 Agenda, which is when we're hoping to achieve these sustainable development goals, recognizes that the centrality of water resources to sustainable development and the vital role that improved drinking water, sanitation, and hygiene play in progressing other areas such as health, education, and poverty reduction. So if you think about food and water insecurity as separate concerns, they don't really make a lot of sense. But once you start looking at the overlap, you recognize that not only are they syndemic, so they co-occur as epidemics in many of the same areas, but also that they sort of exacerbate each other. So food insecurity makes water insecurity worse and vice versa. And we'll go through some examples of how that can occur. But also they have major overlap in their public health outcomes. And so while food insecurity often results in a decreased quality and sometimes quantity of amounts of foods consumed and undernutrition, and water insecurity can interfere with livelihoods, disrupt hygiene, inhibit domestic activities like cleaning and cooking, impact healthcare, including like clean labor and delivery, for example, and influence diarrheal disease and malaria and other vector-borne diseases. When we really look at the overlap of food and water insecurity, we see that the risk of under 5 mortality goes up. There's overall decreased economic productivity, an increased risk of gender-based violence, worse nutrition and health outcomes, and major implications for mental health, such as anxiety and depression. And so, to answer a question that you might have, which I know I've talked about women and children briefly, but I think much of public health research focuses on women and children, and why is that? Well, we know that women and children disproportionately experience the consequence of both food and water insecurity, and because of this, most monitoring programs focus on women and children are also like the canary in the coal mine, right, for the population. So because they're so small and you can see changes happen so rapidly in child population, adolescent populations, is like a clearer route to intervention sometimes, but also it kind of tells us what the population is experiencing at a broader level. And why is this important? Well, it's important because children experience nutrition are more likely to die and often become malnourished adults who then often deliver malnourished infants who then become malnourished children, and it kind of creates this cycle of vulnerability. So returning to my career trajectory, as an undergrad dietetics student, I knew I was interested in international health, and I had the opportunity to travel to coastal Ghana to provide health screening and nutrition education for pregnant and lactating individuals. And one thing I found striking in this small community was the quality of the water, which was brackish or like fresh and salt water mixed, due to the proximity of the ocean. And in the community, the water drawn from underground wells often looked like what you see on the left. And so I was in Ghana to discuss best practices for preparing complementary foods for babies. And I was way out of my depth when I encountered the water situation. Like, how do you make porridge or prepare oral rehydration salts for children with diarrhea if you don't have clean water, right? So what do you do with a child who's feverish if you don't have water or money to buy water? And so this experience really solidified two things for me. So the first was that I wanted a master's in public health to be able to make real change, improving the lives of vulnerable individuals with my career. And the second is that I wanted to join a university with faculty and students who had the same passion for international health that I had. And Tulane brought me exactly that. So during my MPH program, I was able to complete an integrated learning experience at that time called a practicum in post conflict northern Uganda, where we were conducting an observational research study to understand the impacts of food insecurity on HIV and physical and psychosocial health outcomes among women and their children in the first year of life. And because of the 20-year protracted conflict that had ended just a few years before I was in Gulu in Uganda, HIV was higher in this region than any other region in Uganda. And what we found is that HIV had major implications for food insecurity and vice versa, that they were sort of bidirectional. This relationship was bidirectional. Food insecurity impacted nutrition and the absorption of HIV medications. It increased the rate of transmission of HIV via malnutrition and micronutrient deficiencies. It had major mental health implications such as anxiety and depression, which can also increase the risk of substance abuse and risky sexual practices that subsequently increase the risk of HIV. And so, because of the 20-year protracted conflict, there's also a clearly articulated network of non governmental organizations and UN actors in northern Uganda, which meant that food prices were inflated despite the overabundance of interventions to support food security. And individuals often relied on formal and informal markets, such as the one that you see on the left, to obtain food. And many people just lived outside of the city center. They were forcibly displaced during the conflict and often remained in rural areas. And so they sometimes had to walk miles to reach markets. And these factors, along with the lack of formalized economic opportunities and formalized education, since education had also been displaced due to conflict, really contributed to large scale food insecurity, which had major implications for health and well being and were intergenerational. And so after I finished my MPH, I started working on an expanded version of the Ugandan study, but in Western Kenya, which at the time, the HIV prevalence was 15%, which was far higher than the national average. And because of our experience in Gulu, Uganda, we sought to understand how food insecurity and HIV impacted infant feeding, health care, and overall outcomes and well being. And so during our initial phases of the research, we used a technique called photo voice, which is a method where you provide participants with cameras and you ask them to take photographs of a topic of interest. And then they bring those photographs back. You discuss each of them and ask, why did you take this photo? What's interesting about this photo? What should I know about it? And and you're sort of like walked through that process. And then the most interesting photos to the participant will be kind of consolidated into a group of like 3 or 5 and shared in a focus group discussion with peers. And so one topic that kept coming up in photo voice discussions, what in the focus group discussions and the individual interviews, was water. And the prompt that we used was tell me how food insecurity impacts how you feed your infant. And so you can see how we were pretty surprised that folks continued to bring up water, and that water was a major decision factor for many things, even beyond infant feeding. So, for example, whether or not to wake up at 2 or 3 a.m. and walk without a flashlight to get water before a line formed so that you could bathe your kids before they went to school, or if you should buy water or food for your children. And in one instance, a participant directly said, I take the cash meant for beans and I buy water. And so we really started to understand some of these trade offs. But in the areas where we were working in Western Kenya, you could see Lake Victoria, like physically see Lake Victoria, which is a major body of water. It's a really expansive lake from most of the homes where we were interviewing participants. And even though the water is there, it's not of great quality. So participants don't necessarily want to drink it. Individuals don't really want to drink it. So it requires that people, and primarily women and children, stand in line, sometimes pay for water, and often walk long distances or over rocky terrain to get water. And so in this photo, for example, which was taken by a participant's friend during one of the photo voice interviews, the woman standing in the foreground, which you can't really tell from the photo, but she's in very late pregnancy. She recounted that her mother-in-law, the individual in the background, had a tank where she stored clean water, but she wouldn't allow the woman to access it. So she had to go to another water point and spend a significant amount of her day collecting water, and often would like trip or fall because of the weight of pregnancy, creating a really dangerous situation. And so, what we learned is that there were actually four direct pathways that water insecurity impacted women and their infants. And you can see how there's some crossover with food security in the nutrition pathway, but also in some of the others as well. And so, what we found is that water insecurity was impacting breastfeeding and hydration status. When individuals weren't hydrated sufficiently, they couldn't feed their infants. Um, Feeding breast milk instead of complementary foods. So once a baby reaches 6 months of age, it's required that you introduce other foods so they can have a more complete diet. And individuals were delaying introducing complementary foods because they didn't have sufficient water to make porridge, which is one of the early introduction foods in Kenya, in this region of Kenya. And that women weren't eating enough food to produce breast milk, because they were choosing between purchasing food and purchasing water, for example. And so water insecurity is particularly important for women and children beyond infant and young child feeding. And in most low and middle income countries, women bear the physical responsibility and psychological burden of ensuring adequate water. So this can be very demanding in terms of time and energy, and leaves women vulnerable to physical and sexual abuse en route to water sources. Water acquisition also compromises childcare. It precludes women from engaging in income generating activities. And every day, collectively, women and children in sub Saharan Africa alone spend 200 million hours. So that's 73 billion hours per year collecting water. So it's very significant, right? So, public health researchers and practitioners spend a lot of our time measuring things. I mean, it's really how we learn about outcomes, how we make decisions about interventions or policies to impact change. And so, recognizing that water insecurity was a significant issue that presented specific challenges to women and children, especially in the first 1,000 days, we decided to start measuring it. However, we quickly realized that a scale to measure water insecurity across countries and different populations just didn't exist. And so typically what you do in a scale or in a survey, right, if you're a practitioner or researcher, is you use the empirically tested methods to collect data. So like you know that this food insecurity scale is really good. It works in these regions. So you stick it into your survey and you measure how food insecure people are. But if a scale like that doesn't exist, sometimes you have to make one. And so that's what we did. So across 28 countries, working with a multitude of researchers, scientists, and practitioners across many disciplines, we developed a tool called the WISE scale, WISE, that measures how individuals experience household water insecurity. And they're framed around questions illustrated by these pictures that you see. So, for example, one question is in the last 4 weeks, how frequently did you or anyone in your household worry you would not have enough water for all of your household needs? And so we can then summarize those responses from the questions to understand just how water insecure people are, which is something we previously relied on other data, such as access to water, or if a household had soap or not, to be able to answer. And as you know from the picture that I shared, this picture, that having proximity to a water source does not necessarily ensure that you're water insecure. So we were really missing a key component of water insecurity measurement by not asking people about their experiences of water insecurity. So this has recently come out and is an indicator of water insecurity using the WISE scale, and measured across many, many different countries, as you see here. And we'll talk more about that in just a bit. So this work is still expanding. And one major limitation of water insecurity measurement is that we do not currently assess experiences of water insecurity in humanitarian settings. And because I work in areas with compounding vulnerabilities, such as in humanitarian settings, post-conflict settings, refugee settings, that sort of thing, this work is particularly of interest to me and what I'm sort of focusing on now. So we also know that not focusing on water insecurity in humanitarian settings is a big problem, because if you read the news, you'll notice that water is a significant challenge in many areas that experience seasonal shocks, such as drought, or acute and protracted shocks such as conflict or even the intersection of those two things. And so two examples of this are highlighted here with these photos. So for example, on the left, severe drought resulted in a lack of sufficient food and water resources in Somalia, which created a situation where households were forced to relocate in search of food and water. And this displacement is often worsened by conflict, which Somalia also has co-occurring conflict, especially if some actors borders between areas and preclude individuals from moving from one area to another. Another example can be found from Yemen on the right. So after several failed crop seasons and amidst the uncertainty of conflict, farmers started growing khat, which is a mild narcotic, instead of other crops because it has higher profit margins, grows more quickly, and can be harvested sooner than fruits or vegetables, and has more certainty of outcome. It's a little bit hardier. However, it's also super water intensive. So it's ultimately resulted in the decimation of water resources and has exacerbated conflict. And we know that, humanitarian settings, emergencies also weaken healthcare infrastructure, such as food, water, and healthcare, hygiene, overcrowding, a lack of cold chain to support vaccines, can contribute to diarrheal disease due to unclean water, and often result in food shortages, disrupted livelihoods, disrupted social connections, and increased protection concerns. And so it's really important that we think about, the implication of water in humanitarian settings and what that means. And so, as I'm sure you've seen from the news, Gaza, Palestine, is currently experiencing a major food and water crisis that has been exacerbated by conflict since October 2023. But prior to last year, the majority of households in Gaza relied on trucked in desalinated water. So desalinated, the salt has been removed from the water, and then tap and standpipe water often delivered brackish. So as in Ghana, mixed salt and fresh water. And this is something that I actually worked on for my dissertation research prior to October 2023, looking at the implications of the water situation in Gaza on health outcomes of children under 5. And so what we found, though, is over the course of the conflict, desalination plants have been destroyed. Fuel, which is needed to run them, has been blockaded, leading to a major reduction in the amount of water available in Gaza. And so current projections indicate an expected increase of mortality due to water specifically. And currently I'm working with collaborators at the London School of Hygiene and Tropical Medicine to be able to quantify this risk. And we're doing so by pooling data on water insecurity, water access and quality before the conflict, and then coupling that with satellite data that have captured the extent of destruction of water resources, which actually in some places it's easier to see with satellite data how dense water resources are because the storage of water in physical tanks on top of rooftops. And so in a place like Gaza where that is common practice, it's sort of like easy to train language models, large language models to do some analysis of that type so that you can look at the level of destruction. And then also logs of humanitarian items shipped into Gaza at border crossings since last year to understand the full extent of water insecurity. And we've also recently collected data on food and water insecurity in Haiti as part of a larger USAID-funded resilience and food security activity evaluation. And so we work quite closely with USAID conducting evaluations, especially on resilience and food security activities and other activities that are in humanitarian settings to understand the impacts that their donation has on their implementing partners' ability to provide life-saving services like food and water, for example. And so in this activity, we're building critical insight into the role that cash vouchers have on food security and developing a better understanding of the role water insecurity plays in resilience. So if we go back to the map that I showed you previously, where the prevalence of water insecurity is most severe, you can see that it's especially high in places like Ethiopia and the Horn of Africa, Afghanistan, Honduras, and Kenya, where humanitarian crises are occurring, or there are sort of like refugee or migrant crises. And so you can imagine then how important it might be not only to measure food and water insecurity and their combined impacts on public health in areas with these other vulnerabilities, such as emergencies, but also to be able to understand how to ensure sustainable access to food and water for disaster affected populations. And this is where a broader understanding of resilience comes in. Resilience in the food security literature is the ability to absorb a shock, such as economic inflation, conflict, or drought, or other shock, and to be able to rebound from that shock. And so, although we understand very well how food insecurity impacts resilience and the ability to bounce back from shock, we know far less about how water insecurity or the interaction between food and water insecurity impacts resilience. And so understanding resilience is also important because in the past, public health interventions largely focused on meeting immediate needs without really considering the implications of that action. And sometimes, as we know, that can have really severe downstream consequences. And so we now know that in order to build sustainability, we need to build solutions with communities and not for communities. And resilience is a big piece of that. So sustainability is cultivated by creating systems that are agile, responsive, and foster continuous collaboration and improvement, working with individuals to design solutions that are in their best interest. And ensuring that individuals, households, and communities can bounce back from shocks without significant repercussions to their health is critical in ensuring success of any public health intervention. And one way to address the challenge of building resilience into water interventions is by understanding how people cope with water insecurity. So, when households and individuals are resource insecure, they often engage in strategies that can either improve or worsen their overall situation, and in some cases, both. And this is known as coping. And so, for example, households may purchase water on credit, but may not be able to pay off the money that was purchased, contributing to overall household debt. Or they may eat prepackaged foods that are less water intensive to prepare, but they have overall less nutrient density. And what we found from the coping literature is that largely people tend to borrow water from their neighbors when they're water insecure, or from their friends or from their family members. But in situations where the collective population is experiencing resource insecurity, so for example, during like a drought, that sort of social cohesion is really tested in really intensive ways. And so individuals are less likely to loan water or to ask for water from their social connections because sort of like the social connectivity is overall degraded by the emergency. And so, using the experiences that were shared through our global HWISE survey, the one that created the scale with the items that I showed you previously, we were able to document specific behaviors that households across 11 global sites used when they are resource insecure. And so, some of these, like collecting water from a different source, or choosing between purchasing food or water, drinking dirty water, or borrowing water from neighbors, are ones I've already discussed. There are many more. And by understanding how people cope with water insecurity, we can design interventions to make them more resilient to shocks. And so what's really critically missing from the literature on coping and missing from my understanding of coping is what is the sort of tipping point by which folks decide to choose one strategy over another? How severe does the situation have to be before individuals decide to engage in coping in general? And how frequently does this behavior occur? And so I'm hoping to be able to test this out next spring in Morocco, which will allow us to get a better understanding of the things people do to cope with water insecurity, how this influences food security, nutrition, and health, and how the coping behaviors that individuals use will influence resilience and vulnerability, and then overall, how interventions can be designed to improve resilience to shocks that prevent households and individuals from achieving water insecurity. And so, aside from serving as a Peace Corps volunteer in Morocco, I sort of, always kind of kept my researcher hat on. And one thing that I noticed is especially in rural Morocco, that there would often be standing water in the streets and a lack of sort of like a formalized water network in many places. And Morocco is really well known for being a tourist destination. However, in the rural areas, there often aren't clear articulated water networks. And so individuals often just dump water into the streets, and often in the desert sometimes rely on like oases or other natural aquifers to access water, but those are being rapidly depleted by water intensive agricultural practices, especially in the South. So for example, I have a colleague who recently discovered that date farming and watermelon farming in the southern part of Morocco was essentially taking all of the water resources that people had been using to drink and diverting them to agriculture, forcing reliance on trucked in water into communities. So communities would often wait until their allocated time, and then trucks would bring water into the communities. Everyone would line up and kind of like fill their jerry cans or buckets and take them back home, which we know is not a sustainable practice. And so what I'm hoping with this work is that I can get a better understanding of how households cope with water insecurity to be able to build and bolster those strategies so that in thinking about not imposing solutions, but working with community members to see like, oh, if you're already, pooling resources to buy a water storage tank, perhaps we can set up like a village saving loan association, so you can pool resources more effectively. Or if you're, borrowing water from your neighbors, perhaps we just need to figure out, ways to improve water accessibility for both of you or strengthen those social connections. And so that's what I'm planning to do with this work, and it kind of builds on this other work that I've done. And so that is just a very brief snippet of my research. I have also conducted research on pica, so the consumption of non-food items, mostly in sub-Saharan Africa. I've conducted research on gender-based violence in water, food insecurity in water, and water insecurity, HIV, sort of a wider range of public health topics. So if this is of any interest to you, I would implore you, please reach out. I always have sort of an open door policy, either virtually or in person, and I'm always happy to discuss my research more and connect with individuals who are interested in this work. And with that, I'll turn it back over to you, Kathy.
All right, thank you so much, Dr. Collins. And so at this time, if you have any questions, drop them in the Q&A.
Oh, interesting. Okay, so someone says, what would you say is the most interesting work you've done? Pica sounds fascinating. So Pica was fascinating. I like to tell people I ate a lot of dirt for science. um, so I would often go out to the field and interview individuals about eating earth and craving earth. And then in order to do that, sometimes you have to create some camaraderie. And so you say like, oh, I like, this type of clay or whatever. And people say, no, this type is better. You should try it. And you're like, oh, show me where you eat. Like, show me the clay that you eat. And so what we were trying to accomplish in that research is collecting a lot of clay samples from what people were actually eating to understand what was in them. And so pica has long been kind of like a medical mystery that many folks attribute to iron deficiency anemia. It's sort of like written off by many doctors and even medical textbooks and as just something weird that people do because they have anemia. And what we found is that's actually not the case. Pica exists because, for many reasons, we think. One being that it might be adsorptive. So clay actually coats the gastrointestinal tract. So like kaopectate, for example, comes from the derivative kaolin because kaopectate used to be made with kaolin clay. If you think about like your face masks, often they're made with clay because clay is really good at taking impurities out of the skin, also out of the GI tract, but also adsorbing. So like not absorbing, the opposite of absorbing impurities. And so we think, it might have been evolutionary for areas where people have load of like helminth infections. So geohelminths, especially like worms, like intestinal worms living in the dirt. So yeah, pica was a very interesting foray and very different than my my normal research. But it was I'm always happy to talk more about that as well.
All right. Is there any more questions? Please drop them in the Q&A.
And also, I should mention, as a person who attended Tulane for my MPH and PhD, I'm also really happy to answer questions from the student perspective. I completed my PhD last May, so I'm still pretty fresh in the process. So also, if you have questions about, the student, what it's like to be a student at Tulane, I'm always happy to share.
Someone said, thank you. This was great.
Oh, thanks. Thanks for joining.
Please feel free to contact Dr. Collins. Her email is up on the screen. I can also put it in the chat for you all. Like she stated that she is a SPHCM alum, so she can definitely ask those questions regarding the student perspective of the MPH in the PhD program, as well as just giving you information about the International Health and Sustainable Development Department as a faculty member as well. So please feel free to contact her. But if we do not have any more questions, then I am going to give you back almost 20 minutes of your time. Again, thank you so much, Dr. Collins, for doing this present seminar series. Again, thank you all so much for joining our Public Health Discovery Seminar Series. You all have a wonderful day and a wonderful week.
Thanks, Cassie. Thanks,
Thank
everyone.
you. Bye.
Bye.